first episode of Anatomy and Physiology 101 from Spear Medical. I'm Eric. So these episodes are designed to be really bite-sized anatomy and physiology revision aimed at just blowing off the cobwebs if it's a new subject to you, and giving you a really basic introduction to it for you to go and explore further, or a whistle-stop remind and revise for those of you that are very familiar and sort of clued up with your anatomy and physiology. So what we're going to talk about tonight is the journey of blood through the heart. So we're not going to go into the cardiac cycle or anything like that on this episode, just simply the key parts of the anatomy relative to blood's journey through the heart and how it becomes reoxygenated and put back into systemic circulation as oxygenated blood. So, as you can see over here, I've annotated blood as being green for the sake of being able to identify it going through the diagram. Obviously, blood isn't normally green, and I accept that. So, first of all, I'm going to bring your attention to the vena cava. So, we've got both the superior and the inferior vena cava. This is the final journey where deoxygenated blood will re-enter the heart through the right atrium. Once it's in the right atrium, it will then pass through the tricuspid valve into the right ventricle. From the right ventricle, it enters the pulmonary valve and the pulmonary artery. Now, all the blue blood vessels denote blood vessels carrying deoxygenated blood, and you'll notice that even though it's the pulmonary artery, and we get taught quite early on in our our biology sort of education that arteries carry oxygenated blood and veins carry deoxygenated blood, you'll notice that this is actually one of the few arteries that's concerned with carrying deoxygenated blood. So the pulmonary artery carries deoxygenated blood up here somewhere, which is around to the lungs and into what we call pulmonary circulation. During its journey through pulmonary circulation, it will collect oxygen, get rid of carbon dioxide, and then come back round via the pulmonary veins, which once again you'll notice the pulmonary veins are carrying oxygenated blood, one of the few veins to do that, and it'll enter the heart via the left atrium. Once in the left atrium, we'll pass through the bicuspid valve into the left ventricle, where the now oxygenated blood will be shot out at quite some force through from the left ventricle, through the aortic valve and into the aorta, where it will then pass into systemic circulation. So that oxygenated blood will now travel under high pressure to all the parts of the body that needs it. A tiny amount of that blood will actually, as it leaves the aorta, recirculate back into the heart itself, or more the coronary blood vessels, so the coronary arteries that supply the myocardium, the actual heart muscle itself, with oxygenated blood, allowing it to function. So that's it, whistle-stop tour, just aiming at highlighting the journey of blood through the heart and how it goes through its sort of deoxygenated vessels, becomes reoxygenated and enters the heart again as oxygenated blood. Hopefully you found this helpful. Look forward to more anatomy and physiology. Anatomy and Physiology 101. Thank you very much for listening.